My name is Cece, and I am 26 years old, and I work as a property manager here in Santa Rosa. It kind of started when I was in my teens. I always kind of had some knee problems wearing certain shoes. My knees would go out of place. I didn't think much of it except that, it was the shoes I was wearing. I shouldn't be wearing them. It started getting significantly worse as I got older. I have 2 little dogs, and they would sit on my lap. And as they would sit on my lap and my legs were straight, my knees would kind of move out of place. And it really got awful for me. Last October, I was just swimming at Disneyland, and my knee just went out, and it went back in, but it was really painful. So it was something that I needed to figure out what was wrong and really get something done about it. I went to a lot of other doctors. I'm more of a research kind of gal, and I did physical therapy. I did, options of surgery, and when it really came down to physical therapy not working for me after doing it for almost a year, I started, doing some more research, and Dr. Tucker's name came up. So I really wanted to meet her, and as soon as I did, I was sold. The first time I went, I didn't anticipate having to do both knees because, to be honest, I didn't know how my body was going to feel after it. And even though there was a slight discomfort on one knee, I only did one. And I only had to do 2 more sessions of both knees. And just the quality of my life, really, from being able to not, even have my dog sit on my lap to now being able to run and jump and do cartwheels and fall down and not feel like something went out of place or just even misstepping a step. I'm very happy to be here today saying that Prolotherapy has really changed the quality of how my life is with my knees, and I let people know that as much as I can because I really believe in it. She is just such a sweet person, and she really makes you feel like you're not just a patient. You're actually someone that you guys are working towards the end goal of getting you better. It's not just an appointment that she sees you. It's, how are you feeling today? How are you really doing today? What have you been doing now that you can't do before? So there's a lot more interaction, which I completely appreciate as someone who was in pain and really looking towards the experts. Because I'm pretty sure prolotherapy is something that not a lot of doctors do, and the ones that do it, it's really a specialty. It is hard to say that you can trust your doctor because you're not always sure whether or not they know what they're doing. But with her, she knew right off the back what I needed and what was going to help me, and she was right, hands down. I just like to share to people who live in pain because I know what pain is. So as I can encourage this as much as it is, people who are in pain, it's not over. Keep looking and keep striving to find the answers because they're out there. And obviously Dr. Tucker was an answer for my knees. Prolotherapy, you can definitely live without pain.